Good evening. Hello, everyone. This is neuropsychologist Dr. Karen Sullivan with you for another I Care for Your Brain Facebook Live. People have been emailing me quite a bit this week asking me about this terrible virus and how does it specifically impact them as a member of the brain health community. So I wanted to take this time to answer some of your questions to the best of my ability. The brain health community is specifically affected by COVID-19. There are some things that you all were struggling with before that are worse. There are some very unique specific questions that you all have about risk factors. Am I more at risk for maybe getting something like this because of what I've gone through with my brain? So as you all know, if you've been following us for some time, that one of our big values at I Care for Your Brain is that we validate very real problems that are happening within the brain health community, but we also take our power back, and our whole purpose of being here is to empower you with information so you can take that and have a better recovery, go out into the world and advocate for yourself. So the first question we have is the brain as an organ in the body involved in COVID-19? So the very best answer we have right now is maybe, and the evidence is all pretty preliminary. The scientists say that it could possibly target the central nervous system, the spinal cord, and the brain by simply infecting the neurons that come through the body through the nasal passage. So the idea here is that one of the very early symptoms in COVID-19 is this disruption in smell and taste that we keep hearing about. These are the neurological chemical senses. And so just the fact that we know that the nasal passages are involved is a strong indication to us that probably theoretically, it could cause neurological damage. The loss of smell and taste is thought to be due to inflammation that happens throughout the whole body when it interfaces with COVID-19. And the idea is the changes in smell and taste would return back to their baseline at 7 to 14 days, just like all the other symptoms do. So here we have our first intersection with the brain health community. So many of you have trouble smelling and tasting already. 25% of people who have had a traumatic brain injury live with this symptom. Why is this? Well, the first thing that comes to mind is the blunt force trauma that happens with many TBIs, car accidents, falls, assaults, these kind of a thing. And the nose can be involved, the olfactory bulb, the sinuses, the whole inside part of our nasal passages, and the very front parts of the brain, the prefrontal cortex. If you've ever had the chance to look inside of a skull, you know that the very inside is very bony. It's very sharp, and it causes a lot of damage when the brain moves forward very quickly and slams up against these bony protrusions. And so a lot of times we get what we call shearing injuries in the front part of the brain with a TBI. So many people have this difficulty with smell. So right there we have our first unique anxiety. So people with TBI aren't necessarily going to feel comforted that they would know that this was the first symptom that was happening and that they would be able to get to immediate medical care, because they're not going to be able to perceive a change if they weren't really able to smell very well before. The other thing is that there's certain medications that can cause impairments in smell or taste, and these are commonly prescribed for people with brain health challenges. So some antidepressants, some seizure medications, antipsychotics, muscle relaxers, and different types of narcotics. Smell and taste are an overlapping sensory system. The sense we have of flavor actually comes from being able to smell it. That, of course, is what makes us feel hungry, besides just the feeling of needing fuel in our body. So we already have this problem with having a cue to when we are potentially going to eat. So what we worry about is that people who are already having trouble with this symptom are, we think that maybe they're actually in a good position to help other people who are now struggling with this symptom. So as you all know, when you have trouble smelling, you don't get hungry, you can't necessarily taste things. Things actually also taste pretty bad. When you have no sense of smell, things like meat can actually taste rancid. It hurts your saliva production when you can't smell things, so you choke more easily. Things like crackers can become very difficult. The real way to answer this question of how much COVID-19 could infect the brain would be on autopsy. So after someone unfortunately passes away with the virus, we could be able to get in and examine the brain and see exactly what's going on there. Unfortunately, very few autopsies are being done because people are so afraid of catching the virus. We also know that when autopsies are done, researchers are primarily looking at the respiratory system, the lungs, and so we're not really yet having a public conversation about the way the brain could possibly be involved. There was a review article that came out last month at the University of China that hypothesized that if the brain is involved, it's a very specific part of the brain called the medulla oblongata. And this is the part of the brain that you can kind of think of as the control center for the heart and lungs. And one of the reasons that they are hypothesizing this is because if you look at the progression of COVID-19, the respiratory failure happens in a very, very short amount of time. So these researchers are feeling like that is possibly too short of a time to just be a lung issue, and maybe it's actually a primary control issue that's happening in this part of the brain. Within a day, unfortunately, many people are finding themselves from symptom onset to being on a ventilator. So that is a very short amount of time for a very serious onset of this virus. That word ventilator actually leads us to the second way that our brain health community is uniquely affected. This is not a neutral word for my brain health community. Words like ventilators, intubation, hospitals, rehab, these words carry a certain amount of unique trauma to the brain health community. The context in which your trauma happens really matters. Your brain is very smart, and it knows when you are experiencing a threat. Something like a stroke, of course, is a threat. A TBI, a brain surgery. And what your brain does is it tries to really get super crystal clear on what that environment was, what was the context, what was going on right before, during, and after a trauma. And so if you think about hospital experiences for people with brain injuries, it's not necessarily always pleasant. There are very painful interventions. You are potentially pulled out of your life. Your life has been threatened. People might not necessarily be able to interact with you if you're sedated in some way. So for the brain health community, the word hospital, the word ventilator, these are triggers. The sights, the smells, even things years later can become massive anxiety triggers to anyone who's ever been traumatized in a hospital setting. So when you encounter a trigger, what exactly happens? Well, your nervous system basically starts bracing for the impact of another trauma. And this is that fight, flight, or freeze response. Our nervous system basically goes haywire and starts to really prepare us by the blood rushing to our vital big skeletal muscles, our heart, the adrenaline starts pumping, the cortisol starts pumping. That is the experience of anxiety, and it is not pleasant. So we have to be sensitive that when we're saying words like ventilator or someone might have to go into the hospital, that word, that concept is going to be more traumatizing to our brain health community, especially anyone who had a unique experience with a ventilator. So anytime the brain swells beyond the capacity of the skull, we have to open it up for basically a pressure valve. So if you have had a craniotomy or you've had a shunt put into your brain, that is going to be something that has the potential to really trigger you. So we want to be extra sensitive to our people during this time. The next topic is risk factors. I told you at the beginning, this is a big one that I'm getting. Am I more at risk for getting COVID-19 because I have a stroke, because I have Parkinson's, because I have essential tremor? And the answer is no. That is not an independent risk factor for a higher likelihood for getting infected with this virus. Now, that being said, some of the risk factors that led you to having your unique brain health challenge are risk factors for COVID-19. So unfortunately, age in this thing seems to be a risk factor. So many dementias are age-related conditions. We know that they are not inevitable consequences of aging, but what we do know is that it's certainly a risk factor. So we know that many people who are getting the most serious form of COVID-19 are elderly folks, unfortunately. So most people living with dementia are over the age of 65. About 1 in 10 over 65 has Alzheimer's. So the condition that led you to your brain health condition, so what we're thinking of here is COPD, anything related to the lungs, high blood pressure, diabetes. If you had these things before your stroke, and that's part of what led you to a stroke, in that sense, you are at a higher risk for not necessarily getting COVID-19, but having a very bad experience with it all the way up to the worst outcome. So anything that impacted breathing, like I said before. So unfortunately, when people have those risk factors and they get infected, we think they're about 2 to 3 times more likely to die. If you or a loved one lives in a facility right now, this is a risk factor. Anything communal where we have to live closely with people and where people join together is a risk factor. The isolation that is coming along with COVID-19 is very, very important to talk about in the brain health community, but maybe not in the way that you think I might talk about it. So the first thing we think of for every person is that isolation is difficult. It is hard not to be a part of life. It is hard not to go freely to and from places. We hear people on social media talking about being bored, tired of being sick of movies and television. Well, I personally get a little bit stressed when I hear that because I know that my community is isolated at baseline. Okay, when you have a brain health challenge, and if you follow me, you know this is one of my most heartfelt sentiments, is that the struggles you have in everyday life are of course neurological, but there is a level of disability, of pain, of hurt, of struggle that is man-made, and that is the way other people respond to you. That is how little support you get in the official medical community. It's how little money you get on Social Security disability. We know that the world is sadly unkind to people with brain health injuries. We also know that people with brain health challenges can self-isolate. Why does this happen? It seems to be 3 things. The first one is the world is very stimulating when you have a brain injury, overstimulating, and you get exhausted. There is a term called neurofatigue that we should probably come up with a better name for, because my friends help me understand that doesn't even cut it, Dr. Sullivan. That is an underestimate of how exhausted I can get when I'm overstimulated by things. People have a lack of funds usually with brain health injuries to get out and be a part of the world. And I want to know if you agree with me because, again, remember I always tell you I care and have expertise from my perspective, but those of you who are out there living with a brain health challenge, you're the other side of my expertise. So please tell me if you think I'm onto something here. Isolation can take on many forms in the brain health community throughout this crisis. So the big thing I'm seeing is people cannot go to their therapies, physical therapy, occupational therapy, speech therapy, mental health counselors. We are legally not able to be open in our traditional sense. As you know, when you go to a rehab appointment, a therapy appointment, it's not just learning the mechanics and the skills of what you learn with your therapist. It is social time. It's someone that knows your struggles. It's someone who cares about you, someone who's cheerleading you. These are our most important social encounters after a brain health challenge. So one of the things I'm determined to do tonight in this talk is to talk about workarounds. What can we do to improve this situation? Well, this is where that respectful assertiveness that I'm often talking to you about really comes in. I want you to get in touch with that therapist, call, email, whatever you need to do, and ask for their partnership in keeping you on track during this time of self-isolation. Many of us are offering telehealth right now. There's been a scramble in the last few weeks to get insurance companies to pay for telehealth. I have chiropractor friends who are doing telehealth online. How the heck can that possibly work? So that tells me PT, OT, speech can all be done over the phone. If someone is unable to do that, then please ask them for free online resources. There is a ton of things out there on YouTube. If you have to pay anything, it should be pretty low cost during this time. The key is to stay on track with your therapy. Do not allow yourself to lose momentum. That is a plea I'm asking you so desperately. The other way we're being impacted by in-person shutdowns is adult day programs are shut down. Home care is being disrupted. Of course, touch is one of the big things we know is related to the transmission of COVID-19. So guess what's happening in our brain health community? People are saying no to their in-home community caregivers. It's too much of a risk to think that they, because they take care of many people, could come into the home, touch my loved one, and then they're going to be whisked away to the hospital and I can't have access to them. So we have an epidemic of caregiver burnout that is happening right now, and we need to know this. We need to be talking about this so we can provide additional support to this community. Being together 24/7, a dementia person, person living with dementia and a caregiver, this sets the stage for a lot of stress for the caregiver. And something happens very often called shadowing. Because folks with dementia are so dependent on routine, if all of a sudden you're together 24/7 and you're not taking your typical break to go to the library or out to lunch with friends, the security bonds can get very, very strong, and all of a sudden you can have a shadow. And as much as you love this person, this can be extremely suffocating for any person, okay? Maybe right now, though, the ultimate, most painful type of isolation that I'm hearing from in our community is being unable to visit a loved one in a long-term care facility. For so many of you, this was a daily routine. Going to visit your loved one was not only a way that you showed your love and concern and affection for them, but for many of you, you really viewed these times as keeping the person safe and alive and healthy. Caregivers often supplement the care from nursing homes by bringing in additional high-quality foods, by providing socialization, even things like turning people in their beds so they don't get bed sores and pressure ulcers. These are the tasks of caregivers in our country. This is a very real anxiety that we have right now, is what is going to happen to my loved one throughout this whole crisis. We have to remember, though, that the priority right now is one of community. We have to, as you keep hearing about, flatten the curve. And unfortunately, this means reducing exposure to people who live in groups. So please rely on phone. If the person you love can't get on the phone, ask someone you know there, an administrator, to put the phone next to their face, be able to try to send things in. They probably are in need of things like wipes and Clorox and masks and those things. Feel in some way as if you are still helping your loved one in that community. We need to also make sure caregivers are staying careful, making sure that you have food delivered, medicine delivered, disinfecting, staying hydrated. Washing the hands, you're probably sick and tired of hearing people talk about that, but I'm here to tell you, I have read a lot of scientific articles about COVID-19, and one thing that always makes me feel good and positive is when I read about the molecular biology of COVID-19. And what it tells me is that the outer shell of the virus is actually very delicate and cracks open in the face of alcohol and all detergents, which is basically soap. So it's not that it is very strong of a molecule. We know it's extremely contagious, but we also know it has a certain fragility, and that washing the hands is an unbelievably powerful way right now to stay safe. Caregivers are very worried, like I said before. What if something happens to me and I have to leave and I have to go to the hospital? So I want to talk to you a little bit about what are some things that you can do to be proactive. So there is something called advanced directives, and it's very important to make sure that you are staying on top of these things, because even though as humans we often like to put the scariest thing out of our mind, what psychotherapy often helps us do is to make a plan for the worst, because you actually get a huge sense of relief. So draw up a document. What is the emergency plan? What would happen to your loved one if you're a caregiver if something happened to you? Put it right by the door. Give it to a loved one. Put it in an envelope. Have it somewhere where if there was an emergency, you would know exactly what to do for that person. I think that that is very, very important. The next way that I think this thing is affecting my community is that y'all are gonna have more anxiety, more hypervigilance, which means being more fearful of this thing than the average person. And I kind of alluded to this before, but I wanna just open it up a little bit more. So not only is the hospital a trigger, just anything that is unexpected, that is out of your control, is a very strong threat during this time. And a feeling of helplessness is very natural right now. We all feel it as Americans, as global citizens, but I'm convinced that my people who have had a medical trauma are even more susceptible to this. This means you might even be more reactive. You might feel like you have to watch the news all the time. You might all of a sudden feel like you have COVID-19 because you have a little lump in your throat. You're going to be hyper vigilant. You are going to feel on edge. You're going to be pinging all around. Okay, that feeling of anxiety is something that is going to make your underlying brain health symptoms worse. So if you had anxiety before, it will be worse if you don't take control. If you had concentration problems before, they will be worse because we have a limited amount of space in this brain and there's only so many slots to pay attention to life. If you now have some of those slots taken up by COVID-19, you are going to be more inattentive. You're going to have a harder time remembering things. That is just the way the brain works. This is what neuropsychologists know so well. So let's think about, what does anxiety feel like? Okay. Do you feel grounded, peaceful, calm, like you're a good problem solver when you're anxious? No, it is the opposite. You are out there, you are pinging, you are responding to all this cortisol and adrenaline in your body. You're either in a fight mode, a freeze mode, or a flight mode, okay? This is a horrible way to feel. I'm here to tell you this. So you first have to take stock of your body. Be honest with yourself. Am I in a state of hypervigilance and anxiety right now? Okay. When that happens, it's not only a physical feeling, there's also things that happen in your brain. So remember before I said the blood rushes to your heart and your big leg muscles and your arm muscles so you can basically fight back, right? Or flight, run. The other thing is that you can think of the same thing happening in the brain. That brain and blood flow is going to the core part of the brain. This is basically our threat detector, our amygdala. So we are also not very good decision makers during this time. You literally lose contact with some of your prefrontal cortex. So your ability to make good, rational decisions goes away. So the way we have to combat this is the opposite. We have to be very grounded, do things that make us feel like we are in our normal life. We cannot be glued to the television right now. You cannot do that as a brain health survivor. You have to protect yourself from some of this information. Your trauma is going to want you to be with this news 24/7, but I'm here to break the illusion of control for you, because the only thing it will do, as you know, watching the news all day as opposed to a half-hour recap at night, is going to ping up your anxiety. And I'm telling you, you can't afford it if you're someone who has had a brain health trauma. So we have to really, really try to take our mental health serious right now. One of the best things I can tell you is to focus on what is in your control. You cannot control COVID. You cannot control the world economy falling apart. You cannot control what President Trump is doing or not doing and what your opinions are about that. You also can't magically control your feelings. You're listening to what I'm saying, and many of you are very smart, and so you intellectualize it. You think, okay, I might do that. That makes sense what she says. It would actually be very unhuman and unnatural to eliminate fear and anxiety right now. It's a completely normal response to have. COVID-19 is a threat, right? But what you can control to a large degree is how you interface with COVID-19. What you do today and day in and day out, that's what really matters. We have much more control over our behavior than we do our emotions and our thoughts. And this is the key to feeling better. We are allowed to be fearful. That is normal. But we do not have to act on our fear and our anxiety right now. The goal is to control your behavior. You cannot control fear, being worried, being scared, but you can keep doing the things that you know are aligned with your core values and the way that you want to be in this world, okay? Your job is to remain connected to the people that matter to you. Yes, you might not be able to hug them right now, but you sure as heck can communicate with them on the phone. And maybe more importantly, you can hold them in your heart right now. You can pray for them. You can pray for the world. But the truth is, you are not going to be able to have much control over this virus as it extends beyond your house. And realizing that and letting go of that almost unconscious sense of responsibility that you're supposed to be doing something right now, it's not your fault, and there's very, very little that you can actually do. I really want you to focus on the very simple basics right now. Hydration, eating well, and moving your body to the degree that you can. We've talked about hydration. It's critical for all types of health, including brain health. It's also critical for keeping the mucous membranes nice and moist, and that way the COVID virus can't attach in there. When we have dry, cracked noses and sinuses, think about an airplane. That's when we're much more likely to get safe. So I've been doing a lot of saline spray right now. I want you to really focus on what you eat. It is very tempting to just sit here with junk all day long. We are home, we are isolated. Do not give in to the cravings of cookies and cake and ice cream right now. Try to really keep yourself to a very healthy diet. And maybe the most important thing I have to tell you all as my brain health community is do not let your recovery get off track. You may have lost your rehab partner. You might not be able to see your doctor right now. But if you're watching me, you have enough power and control to find some resources. I will help you. Go on YouTube. You cannot lose your momentum. It's just too important. So I want to end with a couple positives. One thing I'm noticing in the world right now is a lot of generosity. People who can give are giving. And just yesterday, I heard that the American Heart Association, which is the leading voluntary organization focused on heart health and brain health, has committed $2.5 million for research efforts to better understand how the coronavirus is interfacing with our brain health community. Isn't that cool? So they're going to fast track research grants, short-term projects, anything within the next 12 months that can uniquely help the management of COVID-19 as it relates to brain and heart. So one of the things that I have in my heart during this time is that I really hope that we emerge from this crisis as better, more compassionate community members to people with brain health challenges. We are getting a little taste right now between the isolation, the threat to our finances. This is how my people live almost all the time, okay? I don't want to stereotype, but the truth is, it stinks to have a brain health challenge and life is difficult. So add on a global pandemic, and I am worried about you guys, okay? So please let me know how you're doing. Please let me know how you're coping and reach out to us for help. Now, I'm gonna end this with a favor to ask you, and I hardly ever do this until I really need it, but I'm very passionate about this subject, and when I watch the news, I am not seeing the unique needs of our brain health community being represented. Here is what I ask you to do. Would you please take my video right now, find out a contact for any local news station, local media, send them my video and ask them to get in touch with me here at the Facebook page for I Care for Your Brain to interview me about what is happening with COVID-19 as it relates to the brain health community. I'm going to be reaching out to some of the news stations here in North Carolina, but you guys have this beautiful reach. We are 7,000 learners strong. You all can really help me right now. So please just forward this over to WRAX and just tell them I listened to this interesting lecture tonight. I really think that you should get in touch with this woman. Interview her about how people with stroke, dementia, TBI, Parkinson's are doing. I would appreciate that so much. Thank you guys so much. I have actually a really big announcement to make next week, but right now with all the COVID stuff going on, my practice is closed for the time being to in-person appointments, but I actually have been able to come up with an amazing idea of how we can stay connected throughout this time, and I'm going to be sharing that with you next week. So thank you guys so much. It means more than ever to be able to stay connected with you here on our Facebook page and in our brain health community. So please stay well and let me know how you guys are doing. Okay? Take care. Bye-bye.